Good evening, and thank you for joining us for this edition of 12 Health. My name is Shannon Hegy, and today we're talking about a very rare cancer called cardiac angiosarcoma, and someone who was recently diagnosed with it, Sarah Downey, who lives in Providence, and her doctor, Dr. Andrew Wagner, who's the senior physician in the medical oncology department at Dana-Farber, is also joining us via Zoom. I want to thank you both for being with us today and for being willing to talk about this.
Thank you so much, Shannon.
So Sarah was diagnosed with cardiac angiosarcoma in February of 2024. It's a rare and aggressive type of cancer that originates in the blood vessels of the heart. And Dr. Wagner, when I had asked you for a bunch of information, you told me that only a few hundred people in the U.S. are diagnosed with this per year. And because of that, Sarah, you had quite a long and frustrating road to diagnosis. So why don't you kind of tell us your story from when you started feeling these symptoms to what you went through in trying to get answers?
Yeah, of course. So I started having symptoms the fall prior to my diagnosis, so in the fall of 2023. And at first, it started with just a virus, a respiratory virus, and my doctor, my PCP, without doing much testing, wrote it off as anxiety, prescribed me anxiety medication. And so then I was kind of on my own to find out what was going on. That led me to have headaches. These headaches ran up my neck, and I thought they had something to do with my wisdom teeth because they ran across my jawline. So then I began the search for a dentist who could perform, could remove my wisdom teeth. And I was just about to get my wisdom teeth out when I finally got a nurse practitioner from my primary care office to listen to me and run some testing. And the same day that my x-ray came back showing fluid around my heart, I actually took myself to the ER, and that is where I received the initial testing that showed that there was a tumor in my chest cavity. And from the first hospital, I was then transferred to a second where I was misdiagnosed with lymphoma. And from there, I didn't feel like I was getting adequate answers or care. So I transferred once again to a hospital in Boston where I spent about a month. And there I got a biopsy where they removed, a piece of the cancer. And about a week after, I found out my diagnosis inpatient and started treatment the same day. And this was all during my last semester at Providence College.
Wow. To just let you all know out there, Sarah is only 23 years old. And I think as a young person going through all of that, and I think you said that you were going through a lot at school too. You were really pushing through, super busy, packed schedule. Dr. Wagner, is this common for people with this diagnosis, for it to be misdiagnosed, misunderstood, because it's rare? Because from what I was reading, it doesn't really have any defining symptoms in every single case.
Yes. Hi, Shannon. Hi, Sarah. It's good to see you. Absolutely. It's a rare disease, a very rare disease. In fact, it's something we actually call an ultra rare type of cancer because of it literally is fewer than 1 in a million people are diagnosed with this each year. And for rare tumors like this, the more common things are the first things that doctors will think about when they're assessing a patient who's got symptoms of things. So a respiratory tract infection, chronic cough, asthma, wisdom teeth, all the things that Sarah described would be so much more common as presentations, especially in a young, healthy person. So it is, unfortunately, common for people to have a delay in diagnosis because first things that we'll usually do is work up the more common causes. But what Sarah did, which was really important, is that her symptoms persisted. She didn't have a good answer as to why she was having these symptoms, and she kept asking for people to evaluate things in more detail, which ultimately led to the imaging studies that showed the mass on her heart.
And correct me if I'm wrong, but when you finally got to see her, Dr. Wagner, you told her that if she had waited much longer, if this diagnosis had taken much longer and she hadn't gotten treatment right away, things could have gone downhill very quickly.
Yes, it's a very serious disease, and her tumor was sitting on top of her heart and surrounding not just her heart, but also what we call the great vessels, the major blood vessels that bring blood into the heart and take blood out of the heart. And as what was happening was that the tumor was compressing those vessels and delaying the return of blood, especially from her head and her arms. And as that progresses, the symptoms can get worse and serious consequences can happen.
How close was she to not walking out of that hospital?
I think, fortunately, when she ultimately received the diagnosis and started treatment, she started to have a response to treatment, and that alleviated a lot of the symptoms that she was having. So the tumor, although quite aggressive, did respond well to chemotherapy, but had they not started chemotherapy at that point, I think she would have been in much more serious condition.
Well, I mean, I know you already know this, Sarah, but to hear Dr. Wagner kind of, regurgitate those facts and to be reliving it all over again, what goes through your mind? I bet you can still remember what it was like when you heard that diagnosis.
Yeah, I was abnormally calm, and I think I've been abnormally calm throughout the entire process. I like having answers. Dr. Wagner can attest to that. And for me, the more I know, the calmer I am. I like to have the full story. And through having information, through researching and connecting with other patients and telling their stories, I've been able to keep moving forward in my own way, where when this disease is definitely, especially having it as a young person, delays much of what a typical young adult would be doing.
Yeah, totally. You've done a lot of advocacy since then, and I want to get into that because not only have you advocated for yourself in getting this diagnosis, you've wanted to help other young people like yourself. And I want to get a little bit into more about what cardiac angiosarcoma is, the treatment options, research, things like that. So we're going to take a quick break, and we're going to dive deeper into this. We'll be right back. Welcome back, and thank you for joining us for this edition of 12 Health. I'm joined by 23-year-old Sarah Downey from Providence, who was diagnosed in February of last year with an ultra-rare cancer called cardiac angiosarcoma. Also joining us today is her doctor, Dr. Andrew Wagner from Dana-Farber. A lot of times when we do these 12 Healths, one of the questions I get is, how do you find these stories? Where did you meet Sarah? And Sarah's aunt is actually the one who emailed us and just had so many wonderful things to say about you, Sarah, about what you've been through and how you've taken this diagnosis, and a lot of people crumple under that kind of weight. And instead, you have stood tall, you've remained calm, and you've used it to help advocate for others. I want to ask, firstly, though, what your prognosis has been from when you were first diagnosed in February 2024 to, I guess, now, because you've gone through a couple different treatments and the one you're currently on is working and has stopped tumor growth?
It hasn't necessarily stopped it, but right now I can say the tumor's fairly stable, at least the tumor in my heart and the metastases that I have in my back and hips.
Because it has spread a bit since your initial diagnosis. What has treatment been like, and how difficult has it been? Has your life basically stopped from where you were before, which was going to school? What were you in school for?
So I was in school for secondary education and Hispanic literature, and I also was taking classes in women and gender studies. And I did still graduate from Providence College in May of 2024.
Congratulations.
Thank you. So the first few months of treatment, once I got out of the hospital, seemed very normal to me because I continued as if I were a senior in college, and nothing was different other than the fact that I, was a little bit more tired and I felt nauseous, but overall I tolerated the treatment extremely well. And looking back, I really don't know how I did that. I felt superhuman in the moment, and I always say, well, maybe it was the steroids, but not exactly sure what got me through. I really think it was the community that I had at Providence College and the friends that I had. I continued to live with my roommates, my college roommates, throughout the beginning of my treatment. That was something that I didn't want to give up. And that community has stayed with me. My friends continue to visit and bring me what I need. When I have hospital stays, they're always there. And that's how I have a smile on my face even when I'm in the hospital, because I always have people surrounding me and supporting me.
Which is huge, because when you get a rare diagnosis, and this has been a recurring theme in a lot of these 12 healths that we've done, but when you get a diagnosis and you're told this is incredibly rare, I think that can feel really isolating, because it's a why me kind of moment. If there's only this many people diagnosed with this, how am I one of them? So to have that support is huge. Dr. Wagner, back into the kind of science into this. Can you give us a little bit more information? Because we hear the word sarcoma pretty often. It's the cardiac part of it that's rare, as to what I understand in this situation. What do we know about that so far, and what is the research and I guess advancements in treatment in trying to help patients like Sarah?
Sarcomas are a family of tumors that altogether make up about just 1% of cancers in adults. And there's probably about 100 different types of sarcomas, and angiosarcoma is one of those subtypes. And there are different types of angiosarcoma to make it even more confusing. So when we get down to cardiac angiosarcoma, we're really talking about very few people diagnosed with it each year. Angiosarcomas can grow very quickly. And I suspect Sarah's tumor grew over the course of a few months to be a very large tumor in her chest. But it also typically responds pretty quickly to chemotherapy. We're still trying to understand the causes of it. For her type of sarcoma, of angiosarcoma, we don't really understand what might cause it. There are other types of angiosarcoma, especially those that arise on the scalp or on the skin of someone who's had radiation, for example, for breast cancer, that are related to UV exposure or X-ray exposure. But those still are very rare tumors. The cardiac angiosarcomas, we really don't understand what drives them. The treatment for these, if we can do surgery, we operate on them, but obviously given the location on the heart and the great vessels, it wasn't really possible. So Sarah's treatment was really focused on chemotherapy. She did remarkably well with it, as she described, tolerated it very well, and was able to finish school. But we also had her treated with radiation to the mass also to try to stop it and consolidate the response that we got from the chemotherapy. But she had a treatment break for a while, and then unfortunately, as is common with this disease, it did show up elsewhere in her body. But as she said, it's being well controlled right now with the chemotherapy that she's receiving.
So you had to kind of come up with a different treatment when you realized that the first one had stopped working.
Yeah, I think, Sarah, correct me, but I think we returned to the treatment that she had received before until that stopped working, and then we switched to a different drug.
And that's commonplace with this? Is it one of those cancers that you constantly have to evolve and kind of revise your treatment to stop it in its tracks?
Yes, I mean, that's right. So for different reasons, cancers often become resistant to their treatment, and we need to change to a different drug or to investigational drug study, or in some cases, we'll bring back other modalities. So we haven't needed to do this yet with Sarah, but it's possible that we might need to treat a spot with radiation if that starts to grow, despite control elsewhere.
In the midst of all of this, Sarah, and a lot of people I think would be living in a lot of fear, like what happens next? I don't have answers as to what's going to stop this tumor or this cancer from continuing to grow. But instead, you've kind of turned this into a catalyst for a mission, right? To advocate to others, to help others, young adults like yourself. And you've even created a website that I think you said is almost ready to launch.
Almost.
Tell us a little bit about that.
So the website was my way of being able to still have an impact from my bed, from the hospital, because earlier this year I had multiple hospital stays, and a lot of the activity that I had been doing the previous year I was no longer able to do, especially once the cancer had spread to my back. So I found I've always loved writing, and it's been a big part of my treatment. And I wanted to give other people the opportunity to share their writing and to share their story. So my friend Angelina Tanzi, who is working in web design right now for actually like a local design company, she and I started this website, which is basically based on interviews with other young adult patients, their caregivers, and their healthcare providers. And the goal is to bridge the gaps and make connections between those three groups of people, because I think that each group experiences illness differently, and experiences get lost in translation. So this is a way to bridge those gaps. And we are still working on getting it ready to launch, but we are so close. I would say within the next few weeks, it will at least be live.
I love seeing you light up talking about it, and I want to hear so much more. So we're going to take another quick break, and we'll be right back to hear more about the website. Welcome back to 12 Health. Before we took our break, Sarah, you were telling us about a website that you're almost ready to launch. It's going to be called echoesofusri.com, meant to allow cancer patients like yourself, specifically, well, I guess especially people your age and, younger patients. Why was that so important for you?
Well, for me, my education has always been very important. And so when I began radiation therapy last fall, I started a master's in Hispanic literature. And I began writing my thesis on narrative medicine. And this is a concept made popular by a professor at Columbia University in New York City. And this concept is looking at medicine through things like literature and through the humanities, and the idea that doctors can learn a lot from literature and the humanities in treating their patients and using that as a way to connect with patients. And so that actually inspired this website and inspired the idea of making a space where these three groups of people can relate and do so through writing, reading, and other media forms that we plan on sharing, such as artwork. And the website also will feature my own stories as sort of a blog, if you will, but I always tend to write a little bit more formally. So a blog with articles and just sharing my perspective as well. So just a space for both me and for other young adults, caregivers, and medical providers.
Dr. Wagner, I kind of see you smiling there in the Zoom. You must feel a sense of pride when you have a patient like this who takes a really difficult hand that's been dealt to her and turns it into something like this.
Yes, I mean, pride is a good word, although, I take no credit for what Sarah has done or can do. She's remarkable in terms of how she's handled this, of course, but also just in terms of her eloquence and her ability to describe what she's been going through. Just a very quick story is about a year ago, I was playing in a fundraiser golf tournament, and I drove up to one of the holes, and there were two young women sitting in a golf cart who were staffing the charity part of it, and one of them was Sarah, and she looked at me, she said, "Dr. Wagner." I said, "Sarah." I said, "What are you doing here?" I said, "I'm playing golf." I said, "What are you doing here?" She said, "I'm just here." And she said, "Are you going to be at the dinner?" And I said, "Yeah, I think so. Why?" She said, "Well, I'm speaking." I said, "Oh, good." She goes, "Well, it's mostly about you." And it wasn't mostly about me, but it was about her journey, and about her perspective on what it's like for a young person to be dealing with a really horrible disease, but she has taken control of her life. And we alter the chemotherapy regimen based on her travel to Spain, for example. It's important for her to do the things that she wants to do, and she feels well enough to do everything, so she does everything. And in top of the chemo, on top of finishing school, on top of um, uh, her her master's program, she's writing a book in Spanish. I think you told me, Sarah. She's making this blog, and she's communicating with and sharing her story with lots of people. And I think that's really inspirational to everybody, to us as part of her treatment team here, to her friends, and to anyone who meets her. Truly inspirational.
I bet you've seen too the difference in patients, because medicine obviously is what we turn to first when we get sick, but there are so many other things that are important in helping us through a difficult diagnosis, through illness. And Sarah seems to have found the other side of that, the non-medicinal side of that. And I'm sure you've kind of seen that through your practice and the way patients handle things, the different ways they do.
Yes. I mean, everyone hopefully will find that resource or a set of resources that helps them manage the difficult time in their lives. Sarah, as she described, is about advocacy, about communication, about writing, about travel, and a really good perspective on life. For others, it's friends, family, religion, other activities. Everyone hopefully will find something that just helps them ground themselves and helps them cope with what they're going through. We do what we can to help. We've got great social workers. We've got a great team. We try to provide whatever resources people need, but there's so much more than what we can do.
Sarah, what would you say to people out there who cannot comprehend how someone as young as you, handed such a difficult prognosis, can be so positive and uplifted and open-minded? Is that who you've always been, or did you have a moment where you said, "Nope, I'm not going to let this take over"?
I think that I have always tried to push through difficult moments with a positive outlook. I see them as challenges, but challenges that I want to overcome. And that's regardless of if my medical diagnosis has a cure or not. I think it's more of a mental game. And for me, that has been conquering for me, the greatest challenge in life is staying present, not looking too far into the future, not worrying about having everything figured out. And that has been what I have had to learn since getting this diagnosis, is staying present and finding joy in the little things.
Not the what ifs.
Yes, exactly.
What would you say to other young people out there who've been handed, whether it's cancer or something else, a difficult diagnosis like yours? What would be your message to them? And I guess well, let's start there. What would be your message to them?
I think a big fear of people my age when they receive a diagnosis is feeling like their friends are moving forward while they're stuck in one place. And I would say that life doesn't have any one specific timeline, that everyone has their own timeline. They get to make it in a way. And that's based off of the choices that you make, even in the face of choices, or in the face of circumstances that you have no control over. So really just trying to take control of what you have, what's within your power.
And I guess my last question to you is, once this website launches, what would be, the moment for you that feels like this is what I wanted, or your goal from it?
We definitely want to get the word out. We want to build our following. And once the website's been out for a few weeks, we plan on getting an Instagram page, because, that's how a lot of young users will find us. And I really want to be able to interview a lot more people. I think the interviews are what are going to drive this website and just get as many voices as possible. And
Okay.
I want to reach out to the medical community as in more medical professionals, doctors, social workers who work in oncology, because I think that their voice is also important, and not hearing statistics, hearing their perspective from a personal standpoint.
That's a really good point. I am wowed by you. I think that you've got a brilliant thing going, and I give you a lot of credit for being handed a diagnosis and taking it and turning around and saying, I'm going to keep going, and advocating for others. And I think that a really powerful thing in the midst of a diagnosis is not feeling alone. And I think you're going to do that for a lot of people, Sarah. I want to thank you and Dr. Wagner for joining us for this edition of 12 Health. And we will make sure to include the link to Echoes of Us on WPRI.com. And I can't wait to see everything else you do in the future. Thank you so much for joining us for this edition of 12 Health.